Hello, friends. I'm Dr. Puja Kapoor, uh, Director and co-founder Continua Kids. So today we are going to have the question answer round, and I'll ask for the questions, please. Can we put up the first question? Hello? Can we put up the first question, please? Hello? Can we put up the questions, please? I think there's some technical problem. Just wait for a minute. Can we have the question, please? Hello? Thank you.
I think I'll guide Nanisha for this.
So can we start? Yes. Okay. So let us start with the first question. My name is Arzan Patel. I'm 2 years, 11-month old. Diagnosis is ADHD with mild autism traits. Therapies, I'm taking OT and ST and neurologist treatment. Uh, if not, I have read that a recent study which mentions metformin to be useful in dealing with autism spectrum. How does it help? How to give? I think I have already answered this question in my previous talk. So this would be the same answer. So yeah, so we've started with this now. There was some confusion before. So let's start with the questions. So the first is Sukh Kaur. Hi, Dr. Pooja. My son was okay until 1 year of age. Afterwards, he stopped talking. He's 2.5 now. He remembers prayers, count from 1 to 20, backwards from 6 to 1, knows Punjabi alphabets too, knows and recognize ABC, and knows linked words like apple, B for ball, and all. He doesn't respond to name, but now he does and plays well with his sister. He always have cold and snotty nose, has congestion all the time. He remembers all nursery rhymes. What do you think is happening? I'm not accepting he has autism as he was normal. So the thing is, uh, the child is there in front of you. Your child is there. If you are not going to accept, then the whole sufferer would be your child. There's a clear cut history that I agree that he was normal till 1 year of age. But now, what he is telling, he's just counting 1 to 20 backwards, knows Punjabi alphabets, knows A, B, C, D, knows A for apple, B for boy, everything, but knows nursery rhymes. But what about his social language? This is all your intelligence. This is all what you have bunked up, what you have recalled, what you have remembered, and that's you are telling by and large again and again. So, but tell me, like, is he social? Is he responding to his name? Is he talking? Okay, Didi, मुझे ये दे दो, please चलो, चलो खाना खाते हैं, मम्मी मुझे भूख लगी है. These are the social words. These are the contextual social words which are required by for the age of 2.5 years. I agree that he's intelligent because he could remember, he could go backward in the counting, but that doesn't count in the social and communication milestone. This is not social and communication milestone. So I'm really, really, really disheartened that you are saying I'm not accepting he has autism. You have to be with your child. If you are not going to accept this, then who is going to help your child? He's 2.5. I agree that he was normal till 1 year, but then now look at the present scenario. So 1/3 of the children with autism show regression after 1 year, 1.5 year, 2 years. In fact, the longest age which I've seen is 4 years. So till 4 years, the child was talking and then he had a regression. So there are cases, 1/3 of the reported cases who have been diagnosed with autism have regression, and it is there. So please accept the diagnosis, because what you are telling me nowhere tells me that his social and communication milestone is normal. Okay. So this question is very, very, very critical, because it tells you two things: that in spite of having good normal intelligence, good normal numbers, prayers, alphabets, poems, does not tell me that I do not have autism. Okay. The only thing is that he should be able to communicate, have contextual vocabulary. If I ask him, where is Sukkar? To tell, okay, I am Sukkar. Or where is mother? Where is father? That is what we called as social and communication milestone. Okay. So I think I've answered your, and some my humble request to please accept the diagnosis and move forward, because you are the only whole soul creator. And I always say that on your in knowledge and intelligence lies your child's future. So please make sure that the child do not suffer, and immediate interventions required are there, so you should provide with that. Okay. Okay. Aditi Joshi, I would like to know, can a child with LKS, so for the general public, I just want to tell you LKS, Landau-Kleffner syndrome. So Landau-Kleffner syndrome is one of the acquired causes for aphasia. मतलब कि जो है, it is not genetic, congenital, it is the acquired cause where a child who was normal for 2.5, 3 years starts showing regression in the social and communication milestones and would not listen to his name, would stop talking, and then that is because of there are EG abnormalities at that part of the brain where you have the speech area and the reception area. So that is what you called as LKS, Landau-Kleffner syndrome. Also, by what age of the child can we treat LKS? The child regressed at 2 and is now 3.5 year now. So look, what age is, whenever you diagnosed LKS, you have to treat LKS. You just cannot let it go like that. So you have to do an EEG, and then once you do an EEG, that is the cause, that is the thing which has to be treated, and then autism could be made better. So even if he is 3.5 and you got to know that he has LKS, he has regressed because of the EG concerns, because sometimes it happens they do not show any seizure or any abnormal body movement. They just would regress in their social and communication milestone, like autism spectrum, which is idiopathic without any cause. So even though the child is 3.5, kindly treat the child, go to the pediatric neurologist, and that would help him out to get the child treated. Okay, please do that. Okay, next question. Next question. Uh, Mohammed Khan. Is muscular dystrophy a cause of delayed speech? Yes. So there are incidences where muscular dystrophy is associated with cognition, low intelligence, and because speech is a higher mental function, so we see some of the muscular dystrophies where they are associated with delayed speech. So yes, the answer is yes to that. Next question, please. Saeed Nazar. My son is 3-year-old now, is non-verbal, autistic features and sensory issues. When a few months age, used to have spasms for a couple of seconds along with upward movement of eyeball. My wife thought he gets excited. I noted that was after meningitis vaccine. Was that infantile spasm? Did I miss the cure? So look, for this, what happens in infantile spasm is they will just do like this. Okay, so this generally happens is in the infancy. Infancy means from till 1 year of age, and these are just jerk like movement where you will just not notice any other thing, and most of the parents they feel like ये चौंक रहा है और ये तो ऐसे ही हो रहा है, नथिंग ऑफ सिग्निफिकेंट, छोटे बच्चे तो ऐसे ही चौंकते हैं. So what they are going to do is like they'll just do jerk, and then either they will cry or smile, and then it happens in clusters. In clusters means after one, after few seconds another one, after few seconds another one, after few seconds another one. So this is what is going to happen, and then you will see regression of the milestones after that, and once they stop, then only the milestones start improving. For that you have to consult a pediatric neurologist, because a lot of time our autistic children also have certain type of movement which are not seizures. So, as you said, when at few months of age he used to have spasms, and You really have to get an EEG to find out whether those were spasms or not. And now he's 3 years, but still, if there is a probability, we could definitely do an EEG. Although this is like we have crossed a few years, because when he was only few months, then we had the spasms. But still, kindly do an EEG, because if EEG shows the concern, we could treat it by some anti-epileptics, so that we could get whatsoever we could get by this right now, even though he is 3 years of age. Okay, so kindly please get the EEG. Okay. Next question, please. चंचल कुमार गुप्ता, क्या एलकेएस की प्रॉब्लम बेड से गिरने पर सिर में लगने वाली चोट से भी हो सकती है? सो अगर जो है वो बच्चा गिर गया है, उसके बाद उसको चोट लगी है और उसके अंदर कहीं ब्लीड हो गया है या फिर डैमेज हो गया है ब्रेन में, तो जो है वो जर्क लाइक मूवमेंट कर सकते हैं. जर्क लाइक मूवमेंट, जैसे इससे पहले वाले क्वेश्चन में मैंने बताया, इन्फेंटाइल स्पैजम्स, वैसे वाली जो है अगर चीज होती है इनके अंदर क्लिनिकली, और तब भी बच्चा रिग्रेस कर सकता है. खाली बेड से गिरने पर एलकेएस नहीं होता है, बट इन्फेंटाइल स्पैज्म हो सकता है. क्योंकि अगर चोट लग गई उसको और वहां पर जो है कोई घाव रह गया ब्रेन में, जो बाद में हील करेगा, उसके बाद इन्फेंटाइल स्पैज्म वाली चीज हो सकती है. ओके, सो आई थिंक चंचल, मैंने आपके क्वेश्चन को आंसर कर दिया. Let's go to the another question. So we have Faryal Khan. Ma'am, my son is of 2.5 years, but he never chew his food like roti, banana, etc. He never respond on his name, but he knows ABCD 1 2 3 and words like see you soon, pani, etc., etc. Please, can you guide me what to do? Okay, so the thing is, my son is 2.5 years, but he doesn't respond to his name. That is a very, very, very good, and I mean, very indicative question, indicative thing, information, that why a 2.5 year would not respond to his name. I don't, again, like in the first question, the sixth question is of the same, that my son knows, wrote everything, ABCD, shapes, numbers, words, but you have to communicate by 2.5 years. मैं उससे पूछूं अगर कि जो है चोट लग गई, कहाँ लगी, आपकी नोजी कहाँ है, आपका टीथ कहाँ है, मम्मी कहाँ है, and those has to be contextual. So every time I tell you contextual, 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 contextual is the word, because नॉन कंटेक्चुअली बच्चे कुछ भी बोलते हैं, आते जाते चलते फिरते, ABCD 3 4 5 6 1 2 3 4, those are of no benefit to me, because वो नॉन कंटेक्चुअल हैं. I want contextual vocabulary, and by contextual is, मैंने अगर पूछा कि 1 2 3 4 सुनाओ, तो उसको 1 2 3 4 सुनाना चाहिए, बट खाली 1 2 3 4 नहीं. मैं उससे पूछूं कि जो है मम्मी कहाँ है, पापा कहाँ है, पंखा कहाँ है, तो उसको पॉइंट करते आना चाहिए पूछने पर. चलते चलते बगैर कुछ पूछे वो इधर बता रहा है मम्मी, पापा, पंखा, वो भी मेरे लिए कोई इंपॉर्टेंस नहीं रखता है. सो प्लीज मेक श्योर दैट यू वर्क ऑन दिस, कि जो है आप अपने आसपास वहां पर कोई अगर जो है डॉक्टर है उनको जाके ये सारी समस्या बताएं. क्योंकि जो है अगर बच्चा जो है, if my child is not responding to the name in spite of knowing ABCD shapes, numbers, colors, blah blah, I will think upon that it could be a case of social communication disorder or autism spectrum disorder. So please आप अपने डॉक्टर के पास जाएं, आप जहां से भी बोल रहे हैं उनको बताएं, और बताएं कि जो है प्लीज इसके लिए चेक करा जाए मेरे बच्चे को. ओके, नेक्स्ट प्लीज. I Swati Verma. My baby is 2 years and 2.3 years old. He recognizes everything. He points out everything. Earlier, around 9 to 10 months, he speak dada, mama, but now he's speaking mama, tata, gaga, or babble only and hyperactive. But good eye contact, read books, very tense. Is this autism or normal speech delay? So you also have to put in Swati that वो अपने नाम को respond करता है कि नहीं करता है. Because again, for me, speech definitely is delayed for a 2 year, 3 month old. Because by 9 to 10 months, अगर जो है, if my child was speaking Baba Dada, right now he hasn't proceeded from 9 to 10 months till 2.3 years. That's quite a long period. And definitely speech would have developed by that. But if it has not developed, I really have to think about कि क्या हो सकता है. आप बोल रहे हैं गुड आई कांटेक्ट देता है, रीड बुक करता है, बट क्या वो अपने नाम को रिस्पॉन्ड करता है? क्योंकि जो है अगेन इससे पहले वाला द प्रीवियस क्वेश्चन वी हैड द सेम थिंग दैट ही वाज नॉट रिस्पॉन्डिंग टू द नेम. सो वी रियली हैव टू फाइंड आउट रिस्पॉन्स टू नेम है कि नहीं है. And you have written down he recognizes everything, he points out everything. So that again is like the point against autism, क्योंकि जो है pointing towards object and recognition and telling goes against it. But name response I'm really really bothered about, and also about that hyperactive part, that is also raising my antenna. I believe that this could not be autism in the pretext of these points, but yes, there are few questions which I really want to need the answers, and that is response to name is very important. The next is whether it could be normal speech delay. But normal speech delay, I'm again question marking it because you have all of put in the word called as hyperactive baby. So hyperactive baby, अगर hyperactive है baby, तो भी at times you get a bit of the speech delay. But so whatsoever reason it is, please, it's my request. I believe it could not be autism, but it could also not be normal speech delay with that pretext of hyperactive baby. I request you to please stop all the mithas and the preservative foods. Channelize his energy. Maybe once he's settled down, he may start speaking more. But in the meanwhile, you have to start with the occupational therapy to make sure that his hyperactivity is consumed. And once his hyperactivity decreases, go to the speech therapy for the insertion of the words. Don't leave the child like this, because 2.3 years and only bisyllable is not a great idea. And I'm putting all my bet on hyperactivity, which you have mentioned, because all other features do not point towards autism. But hyperactive child also at some times could have speech delay. So settle down his hyperactivity and then go for the speech therapy. Don't go for the speech therapy right now, because a speech therapist won't be able to handle the hyperactive child in a better way. So please first calm the child and then speech therapist would do wonders. Okay, I think I have answered. Now let's go to the next question. Rahini Vimla. So does autism affect the learning process of a child? So, Rahini, the thing is that 1/3 of the children who have been diagnosed with autism spectrum disorder have certain concerns with their cognition. Cognition means their intelligence, their buddhi, and at points and that could indirectly affect the learning process of children. So, I really have to find out that it is plain autism or autism associated with cognitive problem also. So if my child has autism but have good no learning concerns, or have good learning good learning abilities, then that means the child has only autism. Whereas if learning also comes in between, Those could be because of the cognitive concerns which do not which declines the success for the learning part of the child. But also you have to make sure that at times autism is associated with ADHD. Autism could also be associated with variety of other learning processes. So make sure sit with your doctor, talk about it, because every other aspect has a different approach. If autism is associated with ADHD, then the thing is like I have to treat that ADHD. If autism is associated with cognitive concerns, I'll find out, I'll do the thyroid, I'll do other tests. Also, will put him to the behavioral ABA therapy so that the learning proceeds in a better way. Again, if the child has learning disabilities associated with autism, then again, the approach would be totally different. So please sit with your doctor and find out what could be the cause of not your child not learning well. Okay? Can we go to the next question, please? Just a second. Yeah. So, so next question is by Savita. My son can identify the items and speak the name correctly, but not when we ask. As and when he notices, he says the name of the item. Or when he wants something, he tries to communicate verbally too, but not fluent and not understandable at many times. Please help. He have no any other stimming behavior. Again, you have to tell me the age. So age is lagging. So again, I think the first question, some similarity is there. So he knows everything, but again, the same thing which I have told you. If it is non-contextual, when I am asking, he has to answer. He telling me the item name when I am not sitting, I am just, he is doing on his own, does not count to me as contextual. You have to understand that he has some problem, because it doesn't matter that he has stimming behavior or not. Maybe he could have just social communication disorder. In social communication disorder, which is like, if this is autism, this is somewhere we have the social communication disorder, and this is where we are normal. So, I'm somewhere in between, but still I'm not normal, because if I'm not identifying, if I'm not telling uh, when asked for, and I'm just telling by my choice, that makes things very complicated. Okay? So I think you again have to show to the doctor, because I am suspecting social communication disorder, but definitely because you said no stimming behavior. But yes, this is not exactly the normal child. Okay. So let's go to the next question. Hi Priyanka. Priyanka Day. The question is, can autistic kid go to the normal school, or they have to go to special school? So this is a very tricky question, because it all depends on variety of factors. Number one, do you have schools which have inclusion, normal schools which have inclusion? Because there are schools which take our autistic child, but as with the normal setup with normal children, and that is called as an inclusion school, inclusive school. So if there aren't any inclusive school, that obviously we are left with the option for a special needs school. The second is, what is the degree of the severity of the child of with autism? So what is the degree? That is very, very, very important, because if I am severe, I mean, I may no school would be like able to help you out, and because the school is also for communication and socializing, but also for academics. So if I am very severe and I may not be that, the teaching whichever is there in the class is not going to help me in a good way. It's not going to help me at all, basically. My requirements are totally different. Maybe my requirements are of the sensory diet. My requirements are like approach through a ABA rather than just a normal school where I've been just made to sit because I'm so lost in myself that I don't understand whatever the teacher is telling me and neither I'm interested. So the thing is, we have children with autism who are going to the normal school in the inclusive setup, and obviously if there are no other option, the next is to send the child to a special needs school. Okay, can we go to the next question, please? Okay, thank you so much. Thank you for the questions. So I'll just run through the comments. There are like a few comments which are there. Okay, so let's go to GK. So where are we starting from? Are you starting from the first question? Let me just see. Hmm. So let's go to GK. There's a child, there's a person called as GK with the identity of GK. He has put up the question. My boy is 4 year old. He's pointing out to the object. Eye contact is good, but he responds 5 times out of 10 times. He's very much social. Vocabulary is also good, but not able to form sentences. Okay. And next is diagnosis is of ADHD and medication is also continuing. After medication, there's a lot of improvement. So, GK, as your child, we also have the same question with us that the child eye contact was good, pointing was good, but name response was, don't know much. So, over here, we would like to again highlight, as GK has pointed for his son, that the diagnosis of ADHD was made because the child was hyper. His child was hyper, and because of that, he has received stimulant. Stimulant is the medication, and he says that after medication, there's a lot of improvement. So the take-home message from GK is that at times you have to start with the medications for hyperactivity because he himself said that the child has improved a lot after therapy. So that means there are a lot of parents which we see, they say, I am not going to give medication no matter what happens. It slows down the brain, it do a lot of damage to the brain. So here I would like to highlight the point of GK. He's so beautifully described his son's progress. So please, everyone, please listen to this. This is an important message to be made that medications are not always bad, and sometimes we give the medication for to the child to make him better rather than to make him dull or dependent or things like that. Okay, so uh, Shikha Batra. Ma'am, please tell us about ABA therapy and how does it help the child? So, hi Shikha. So, there's a whole lot of series of mine where I've talked about ABA therapy. Kindly just go to the YouTube and put up the ABA therapy, and you'll get a lot of my videos where I've explained about ABA therapy in detail in one of the sessions. Okay, that will help you out. So there's one more question which I'll take by Ranju Sinha. Hello, ma'am. My daughter is 9 year old and OT and speech therapy are going on, but she is very aggressive and rigid in her behavior. She can cry anytime, and if she want anything, and I said no to her, then she will get angry. She has mild autism and she's taking seizure medication, melatonin and Concerta for hyperactivity. So the thing is, Ranju, again, I have videos for this, that how to manage tantrums in children. But again, I'll just brief you up on this. That's a very elaborative video which I have. You can go through that. But let me just take this question, that she is very aggressive. So make sure that you don't give, first of all, and because she's grown up, she's 9 years old, you just cannot. I mean, she's big enough to tell you, and if you say no, she'll overreact, and it will be very difficult for you to handle because she's already grown up to 9 years. So the thing is that make sure that whenever you say no, you have to be ready for the tantrums, for the aggression. So if suppose she cries for, if on your saying no, let her cry at that point of time. Don't try to teach that don't cry, it's okay, I am your mother. Just stop everything, sit at one corner, and just ignore her crying. Because she has fed into her mind that if I will cry, my mother is going to look towards me and would do whatever I want. So if you have said no to a certain thing, that make sure you should be ready for her cry for maybe an hour or 2 hours or 3 hours. I don't know her capacity. For a 9 year old, it could be 3 hours. So please, please, please make sure that if you are saying no, stick to that and make sure all the family members say so. If you say no, then they're very smart enough. They'll go to father. If he says no, they'll go to grandparents, and they'll find out the way to get yes from somebody. So make sure the whole family stands together to say no. Make sure that whenever she's crying, just let her cry if that no is genuine. So it should not be no for everything. Also you have to make a distinction that you have to make sure that if the demand is genuine, you have to give to that. If the demand is ingenuine, you don't feel that this is to be done, that is the time then you say no. But then be prepared for a cry for hours. And after she settled down, maybe at her bedtime, when you are telling her stories, tell her, Mama said no because you did this, and that is why I am not sleeping with you for next 15 minutes because you did not listen to me. At that point of time, when the acute tantrum or the aggressive behavior or the rigidity is there, don't talk anything, because that will aggravate the anger, that will aggravate the aggressive behavior. Make sure at that point of time you have to have more patience than your child. And once the thing settles down, then you go for the positive reinforcement or the negative reinforcement. That means, if suppose she did not cry for maybe for one thing, for what you said no, you tell her at night when she's calmed down, that because today you said, you followed my command and you did not cry when I said no, so for that I'm going to take you for a round. Mama is going to make you something special for you in the food, something, maybe a star, anything which makes small pleasures which make the child happy. So make sure you, that is what you call as positive reinforcement. And once you don't do the thing, and that's called as negative reinforcement. So in our culture, there's a lot of for the positive reinforcement, and we do very little of the negative reinforcements. So make sure you do this all, and also simultaneously you can watch the video so that you have a better picture of what I'm talking about. Okay. So I think these are all the questions which we have. We'll move to the these questions would be added for the next session. And thank you for watching. Thank you for bearing with all the technical concerns. And hope you liked it. We'll look forward for more questions so that we could make some changes in your life in a better way. Thank you so much. Take care of your children. Bye. Good night.